If the anemia is from mild to moderate, doctor usually try to treat this type of anemia with some foods which have more iron in it. Usually people tend to take more carbohydrates which has less amount of iron, but by taking balanced diet which is rich in iron and folate can help to overcome the deficiency of anemia. These foods includes red meat, eggs, beans, spinach and green leafy vegetables, peas, seafood, nuts, dry fruits, lentils. These are all foods which have a certain amount of considerable amount of iron in it. By taking them regularly can lower the deficiency of iron in your blood. But if the symptom or if the anemia is in severe condition, then these foods are not going to help you. Then you have to go for other treatment options. Other treatment options include oral iron, which are known as oral supplements, iron supplements, which are usually taken as iron sulfates, which comes in the form of tablets, capsules, powder in the sachet form, which can be taken on the daily basis depending upon the severity of the anemia. But most of the time these oral supplements can cause severe allergic reaction and gut problems. So people may have diarrhea or any other kind of symptoms by taking oral supplements. If a person is having allergic reaction due to these oral supplements, then we will provide them with other supplements in the form of injection through IV fluid. So injectable iron, which comes in so many different forms and different impules, can be injected through IV solution into the body. But if it's not causing any problem or any allergies, then this is a best method to overcome the deficiency of iron in the body. But some people may also have allergic reaction to these iron supplements. Then we have to do blood transfusion in severe cases, and when there is no medication is working, then blood transfusion after cross matching is performed. If the deficiency of iron is due to, or the anemia is due to vitamin B12 deficiency, then we inject vitamin B12 via muscles, intramuscular injection, to overcome this problem. Erythropoietin shot can also be given if there is a shortage of erythropoietin protein, which is responsible for erythropoiesis, which is the formation of red blood cell, to overcome the shortage of this protein so that formation of red blood cell can be enhanced. In some severe cases like genetic diseases like leukemia, thalassemia, sickle cell anemia, and then we have to perform bone marrow, because when we transplant bone marrow from a healthy donor to a person, then their bone marrow, because blood cells usually are formed in bone marrow, red bone marrow. So by transplanting bone marrow, healthy bone marrow to a patient can also helps to overcome this problem.